Hi, my name is Lola Pruitt, and for my anatomical variants presentation, I have chosen the four chambers of the heart. So first, the four chambers of your heart include the right and left atrium and your right and left ventricles. The myocardium muscle of the heart heavily relies on these two atrium and two ventricles. As you can see here, the myocardium is one of the most important muscles in your body because it's constantly contracting, needing the right circulation for proper nutrients and oxygen. The myocardium also makes up the thick middle layer of your heart, which you can see right here is the thick pink middle center of this visual representation. The right atrium receives the deoxygenated blood, which is inferiorly and superiorly received from the vena cava vein. The Eustachian valve basically tells the vena cava vein where to send the oxygen, which can be various parts of the body. The structure is a posterior smooth wall and an anterior portion, which the anterior portion is just a bunch of small muscular fibers as protection. The regions are structurally separated by a terminal crest, which is a C-shaped crest. It's very thick in the center. The left atrium is the quite opposite. It receives the oxygenated blood from the lungs, which is delivered clearly by the pulmonary veins, which travels back to the lungs. The structure is way more simpler than the right atrium because it's almost 100% smooth muscle fibers, and it's only found in the auricle of the left atrium. So although you would think talking about different variants of the chambers of the heart would lead to a dangerous or even deadly situation, most of the time this is not the case for the two defects I'm going to be talking about today. 25% of the population has an undiagnosed case of PFO, which is referred to as patent foramen oval defect. The symptoms do not show in most of this percentage of the 25% I just talked about. PFO is a condition that occurs at birth. It's mostly harmless. In simple terms, you're left with a small valve-shaped space between your right and left atrium because the foramen oval is the pathway of direction which oxygen travels from the umbilical cord to the fetus. It's supposed to close once the baby is born. However, sometimes it does not close all the way. And most of the time, if it's even addressed, it's caught during a yearly checkup through an echocardiogram, or sometimes because patients show symptoms of asthma, so it can be treated just like asthma would be treated. However, in very rare cases, it is brought up and addressed because of a stroke or blood clotting in adults. But there is good news that I will talk about treatments in a few slides. Next are the ventricle variants. So the right ventricle makes up most of the anterior surface of your heart. The right ventricle is also responsible for pumping the oxygenated blood into the lungs. So these are quite opposite of the left and right atria previously talked about. Like I said, it pumps the oxygenated blood into the lungs. This way your body can remove carbon dioxide and allow your lungs to inhale deeply and receive the new oxygen that your body is needing. The left ventricle is infero-posterior area of your heart, and this provides the marking over the heart's posterior inferior surface. It's responsible for pumping the blood that is lacking oxygen into the pulmonary valve, not the vein, and this is where the blood is responsible for reaching different parts of the body. So goes hand in hand with the right atria. The variants of the ventricles can be described. A common condition that describes this is VSD, which is ventricular septal defect. So the wall that separates your two ventricles is called the interventricular sulcus. It lies anterior of one of the main arteries, and in very rare cases, it's caught in an ultrasound. An ultrasound while the mother is pregnant with the fetus. However, depending on the size of the hole, it may never be noticed. Only 3 in every 1,000 infants are diagnosed with VSD, but many people are diagnosed with it later in life if they start showing symptoms. And like I said, many people think they're just suffering from asthma. So this is kind of the opposite of the atria defect, because the atria defect is a valve shape from the oval closing, and this is a hole that is previously born there. VSD can even change the directional blood flow in your heart, causing the oxygenated blood to travel back into the lungs before circulating through the rest of the body. Essentially, this sounds dangerous, but it's harmless because VSD, again, just shows asthma symptoms. This is why it is very similar to the atria conditions. So, like I said, regular checkups through an echocardiograph. These tests show clear images of the hole or the valve-shaped space. So the right atrium, most of the time, is where you're going to find where the Eustachian valve hasn't closed completely, or the space around it hasn't closed completely. It's not as common to find this in the left atrium or the ventricles. It can be vital for some patients because without proper functioning of the Eustachian valve, the oxygenated blood cannot be delivered into the left atrium, which is crucial for the lungs. Like I said, through the echocardiograph, this is where these symptoms are addressed. When the left atrium fails, strokes are most common in older people. The atrial fibrillation happens when the left atrium is put under stress, such as heavy consumption of alcohol, obesity, and sometimes stress itself. So these symptoms can be managed. It causes extreme enlargement of the left atrium, and blood supply cannot make its way to cardiac muscle. In many cases, the test shows a hole about the size of the tip of a toothpick, so very harmless to the valve and pulmonary veins within the ventricles. Symptoms of PFO include shortness of breath, low oxygen levels, severe low oxygen levels, and frequent dizziness. VSD includes fast breathing, rapid heartbeat, and frequent cases of RSV. There are medications that keep large amounts of excess fluid from flowing freely during the heart for VSD treatments. However, in most cases, PFO does not need to be repaired. There are small catheters that can be placed during surgery, but most people like to avoid surgery and just focus on recovery. And here are my references that I use.